Hi, I'm Dr. Jake Wyllie. I'm the Director of Rehab here at Bridge Integrative Medicine, and I'm excited to have you seeing these videos. That shows me that you have the initiative to do something about the pain that you deal with and not just live with it. So that being said, I have not examined you. These exercises are not intended for you to self-diagnose or self-treat, but they're just simple movements that we begin people with here in our rehab department. If you do experience pain through any of these exercises, please contact your healthcare provider, or if you're here local in the Kansas City area, we'd love to have you stop in at Bridge and let us get to know you and customize care for your specific pain. Hey guys, I'm Dr. Jake. I'm the director of our functional rehab program here, and let me kind of tell you what functional rehab is really about. I'm a chiropractor by trade, but my background is really in engineering, and so I'm going to kind of walk you through what I think of when I look at functional rehab and why we even named it that. You don't often hear that. So engineering is my background. I love movement. I think the body is designed to move well, and so when we don't move, we hurt, and that's really why we designed this program. You've probably seen through our office that we have 3 different branches. We have the medicine side, we have the chiropractic side, and then we have the functional rehab. And so I'm gonna just kind of share some of why I love this room, why we built this room, and a little bit about the results that we have coming through it. So first of all, when we think about traditional physical therapy, there's a lot of greatness to that, but one of the reasons we built functional rehab was to find how can we improve on what's already good out there. And the thing I love about it is in this office, we don't want to just know about your knee. We want to know about everything that bugs you because we know they're connected. And so in our program, you're going to work on everything that bothers you because chronic pain is never just one thing. It always deals with compensations, and it always leads to other problems that come down the line from that. So let me start with this. Most people that come here are dealing with some level of arthritis. I would assume you're the same. So I'll start you with a little quiz. Let's take a marathon runner, right? Somebody that's run 26 miles and they've done this 20, 30 times that they've run a competitive marathon. So that includes all the probably 3 to 6 months of training that goes into that. These guys are running all the time. And then you take a non-runner. Whose knees are worse? About 90% of the people that I ask that assume it's the runner that's putting that constant wear and tear on the knees. There was actually a study in it was the Journal of Bone and Joint Surgery this is just recent, 2018, that said that it's I guess you call them the chronic runner, the one that is always out there putting miles on their body. Their arthritis rate is half of those that don't run. So it's not about how many miles you put on your body, it's about how the quality of those movements and those steps. That's what functional rehab is about, is creating quality in your movement, and so that you don't hurt and cause the wear and tear that leads to so much of the pain that we treat here. So that's really our emphasis. We can go into more about why it's so important, but I would just leave you with this thought that functional rehab really is the investment in a long-term solution. You can do things to change how you feel today, but without the rehab component of it, that thing will come back. We have to change how that knee works or how that low back works if we're ever going to change it for the long term. So that's kind of the big picture. Let me show you a little bit of what we do in our rehab so you can get a feel for what a day in our program looks like. So we have so we go through a rehab card. It looks like this. And some of the things on there that you'll notice, your name will be here at the top. We want to know you. It's not just about your condition in our office. We want to know you. We want to know what the problems are that you deal with. And as I stated before, it's not just one problem. We want to know 5 or 6 different ones and how we can change those. And then I love this piece of our card because it's your why. It's why you chose to come address this. It's not just pain, it's what pain's keeping you from doing. And so we want to know that. Some of my favorite whys are, I want to be able to get on the ground to pray with my congregation. I want to be able to get up and down off the floor and pick up my grandkids. I want to be able to play golf again. I want to play tennis with my husband. Those are what we get excited about, is helping you achieve the things that get back to quality of life and not just not having pain. From there, we're going to work into some spinal warm-ups. So let me just show you a kind of a short version of some of our favorite spinal warm-ups. we don't move enough in general. In America, we sit for most of our day. And so one of the things we always start with is a little bit of just movement, mobilization. So we're just gonna rock back and forth and get some motion through the low back. My back's even a little sore here today, and so as I do this, I feel the stretch and the movement. And in general, if we can move an area, we can bring health and healing back to it. So it just begins with a little bit of warm up and movement that way. Then we step over here to the side, and either on a ball or foam roller, we can lay back over this and stretch all the way back over here. One of the designs in this program was to have things that you could do simply at home and wouldn't have to use thousands and thousands of dollars of equipment. Don't even have to have a gym membership to do these things. We wanted to build a program where it was sustainable for you to take what you learn here. A lot of this is education more than just do what I do. We want you to have the tools to now be able to go home and continue this. Remember, we're about a lasting solution, not just a short-term one. So these are great things. You can see just that stretch by itself takes us out of this posture where we're going to be at a desk or on a phone. Just by moving back in this direction, we add extension to the thoracic spine, which then undoes the effects of poor posture that we all carry throughout our day. I'll skip a couple of ours, but let's move into our balance section. That's usually where we go after we get our spinal warm-ups. So you'll find a lot of different tools here. I'm going to start just with the foam pad. It just has a little bit of give and spring to it, but this is a great tool for challenging your balance a little bit. So as you stand on here, we'll start you in different progressions. Some people will start without this at all, and they'll just be on the solid ground, but the next progression up would be on something like this to challenge your balance a little more. One of the rules we use throughout our rehab, you'll hear us say a lot, is you can't change it unless you've challenged it. So with balance, it's the perfect example of that. We'll have you start with your feet wide, and we'll have you stand here looking straight ahead. If that's pretty easy, then we'll have you start to turn your head side to side. That still feels pretty stable for me. So now I'm going to put my feet close together and do the same thing. A little more wobble back and forth there. Now I'm going to get more challenging, and I'm going to close my eyes in that position. It's amazing how much, just trying this at home, closing your eyes, how much you lose your sense of balance. I can feel myself rocking here, you can probably see it. And as I turn side to side, it gets even harder. So we have everyone challenge their balance. It's amazing to see the progress that people make from day one, where they can't even stand with their eyes open in what we call a tightrope stance. They can't even stand there, and by the end of it, they might be on the ball like you saw me start. They might be on a wobble board and be able to stand on this and balance this way. Truly incredible, the progress that happens. But unless you are working on that consistently, you'll never retrain your body to move that way. Balance is obviously a crucial component of a lot of the knees that we work on. They found a very direct correlation to if your knees hurt, almost inevitably you have poor balance, and if poor balance leads to knee problems. So there's this cycle that happens, and so any rehabilitation that doesn't include balance for the knee is a mistake. Let's go into some of our trigger point work now. So we're moving down here. We got through our warm-ups into our balance. Now we're going to do some of our trigger point work on this back page here. So I'll show you just an example of some of these. This is a great tool. A lot of what we're teaching you is not what we can do to you, but what you can do for yourself. So this one consists of just putting some pressure into those areas across the top of the neck that are tender. That's the spot right there. And as I push and pull down with just a little bit of pressure, I increase the pain for sure, but also what we're doing is called ischemic compression. We're trying to get the trigger point that doesn't allow the whole muscle to stretch the way it's supposed to. It pushes in that area. We push a lot of the blood out of the area, and then the body says we got to send blood back there, and it helps that area start to begin stretching. So that patient that has, my neck is always tight, no matter what I do. If I get adjusted or if I stretch, it doesn't matter. It always is tight. These trigger points are fantastic for that. So we'll work through these trigger points. You'll find the areas that are most tender for you. You'll spend a little bit of time on them, And then we always follow up our trigger point work with an active stretch. If you felt like I was talking to you about the posture and you sit in this position, I guarantee that your neck is tight. And so we'll work on that, and then we'll just gently let the head stretch to the side and then rotate down to the pocket. If you can work on those muscles, you'll start to let these muscles relax. And again, it's about retraining that muscle to remain long the way it's designed and not to always go into tight and spasm. So that's some of the trigger point work that we do. I'll show you one for the lower half in here. Again, simple tools. It's just a lacrosse ball, but we work on a lot of trigger points in the hips through this. So I'm going to take this ball, set it right behind my hip, make sure I'm not on any of the bones there, and just into the muscle. And I'm just going to lean into those areas, and you'll find some that are tender, and then you'll find others that are really tender. And so we're just going to spend a little bit of time working back and forth in those, increasing the blood flow and reminding the body of how that muscle should lengthen and how it should stretch. So after I spend a little bit of time working on that, then again, we're going to follow that up with an active stretch. So if your hip is sore and tight, that is a great place to start, and then just pulling across here. And that little stretch, you'll feel into the hip significantly there. We find in many hip and knee patients that these muscles are always chronically tight, and these are some tools that they can do not just in their office as they rehab, but at home. And so we want to, almost anyone that goes through here has these tools at home that they're working on them as well. So then kind of the last thing I'll show you is our corrective tracks. We design based on a functional exam that we do. We determine what the biggest problem areas are for you, and it's not just what hurts, but it's what doesn't work the way it's supposed to. And that allows me as our director of our rehab program to design with the medical staff, design a program for you that's really customized to what you're after, and ultimately to achieve that why we talked about. So let's take the knee, for example. One of the things that we'll start with is just some real gentle mobilization. So just starting to get some motion back into the knee. Remember, it's about the quality of movement, not the quantity. So we want to train the knee to move appropriately. We've already warmed up the muscles around the knee with balance. Once we can get that knee moving smoothly, then we'll often start working on a little bit of strengthening through it. I like this movement simply just to train the quad muscles to engage. If the quad doesn't work, the knee will hurt. The muscles are designed to take the load that the knee otherwise will have to endure. So the stronger the muscles are around it, the more coordinated they are in their movement, the better they're going to do. So this is designed to work on this muscle on the inside of the quad, and also builds full range of motion and extension through the knee. So we start to build some strength through those in this way. Then we'll, let me show you the stool slide. This is a favorite. This is a little fun and a lot of exercise too. You're gonna find a stool like this, and it's simply just pulling, digging your heel in and pulling with the hamstring. The hamstring is one of the most important muscles, often forgotten when we're dealing with knee injury, or especially chronic injury. But the strength of the hamstring and the ability to control how the knee moves is a big part in recovery. So we're just sliding along this way, and I can feel all of that right leg pulling me along, and that's a lot of the strength that we build behind it. After we get the joint moving and we get the muscle starting to have the right length, we've got to strengthen it so that the joint doesn't take the wear and tear. So that's a little bit of what we do. The program is all encompassing. We are after not just a knee, not just a shoulder, but we're after you feeling great again, and that's why we built it. That's why we love it. Hope you come in and take advantage of it.